washing my hands right now. My name is Andrew. I'm the nurse practitioner student that's going to be assessing you. Is it okay if I touch you during the assessment?
Yes.
Okay. I'm observing his mood and his general appearance. He seems to be appropriate, not disheveled. I don't see anything remarkable in his overall general appearance. Next thing I'm going to do is take your pulse, if you don't mind. There you go. I'm actually going to do it on both sides so I can assess for pulsus alternans and pulsus paradoxus. His pulses are +2 and symmetrical on both sides. While I'm doing this for 15 seconds, I'm also going to be observing his respiratory rate for a full 30 seconds. For the sake of time, I'm not going to go the full 30 seconds, but in a regular assessment, I would. I'm going to take a look at your hands now. Your nails, they look appropriate. They are not clubbed. I don't see any striation through them. Cap refill on the right is less than 2 seconds, and capillary refill on the left is less than 2 seconds as well. I don't see any visible lesions on his skin, face, or anything like that. If it's okay with you, I'd like to check your head now. I'm checking his head for any masses or lumps. Any pain when I'm touching you there?
No.
No, okay. Now I'm going to assess his lymph nodes, the occipital area, down the back of his neck, then down the sternocleidomastoid, and under the chin. I'm not feeling any lumps or masses. Does any of that hurt?
No.
No? Okay. Nothing in the facial area. All right. For the next thing I'm going to do is assess your cranial nerve 11, and by doing that, I'd like you to push against the side of my hand. All right, great. Also on that side, normal strength. Go ahead and shrug your shoulders up to your ears. Okay, now go ahead and put them back down. Do it against my hands this time. Symmetrical and even on both sides. I'm going to examine your trachea now. The first thing I'm going to do is place my hand right here and locate the tracheal isthmus. Or excuse me, the isthmus of the thyroid. Go ahead and swallow for me one time. Okay, I feel it move up. It feels symmetrical. Now if you'll turn towards me, I'm going to palpate the thyroid. Go ahead and swallow for me one time. All right. And we'll come around and palpate it on the left side as well. And swallow for me. Thank you. No masses or lumps. It doesn't feel enlarged. It feels pretty normal to me. Moving on, the next thing I'm going to do is look at your eyes. I'm looking at their general appearance. I don't see any redness or masses, no fluid or anything seeping out, no discharge. I'm going to take a look in your pupils real quick. Go ahead and look right here at my nose. Okay, and now I'm going to look at the opposite eye as I shine the light in. Okay. His pupils are even, round, reactive, and light accommodating. Cranial nerves 2 and 3 are intact. I'd like you to follow my finger, hold your head steady, and just follow my finger with your eyes. Okay, extraocular movements are all intact as well. So cranial nerves 3, 4, and 6 are good. I'm going to take a little closer look at your eye, if you don't mind. The sclera is white on both sides. The cornea looks okay. I don't see any scratches. I'm going to look in the conjunctiva underneath your eye here. Slightly reddened, but you have seasonal allergies, right?
Yes.
Yeah, so I think that's probably the reason for that. Okay, the next thing we're going to do is take a look at the inside of your eye by doing a fundoscopic exam. This would normally be done with an ophthalmoscope. The otoscope that I ordered was supposed to come with one and did not. So I would normally use an ophthalmoscope and be looking through his pupil. The analogy I saw is that it's like looking through a keyhole. The first thing I would do is look very closely through there, and I'd look for the red reflex on both sides. The other thing I would want to do is visualize the blood vessels on the back of both eyes, as well as the optic disc and the retina. Again, I don't have the ophthalmoscope. My understanding is you need to get pretty close to be able to see that. So moving along, we will now take a look at your ears, just their general appearance. They look normal on the left, also normal on the right. Don't see any discharge. I'm going to use my otoscope to take a look inside the ears now. Okay, so we're lifting the pin up and backwards to visualize the canal, which is clear. And we can see the tympanic membrane, which is a nice pearly gray and is not bulging, so I don't think there's any ear infection going on there. And we'll do the same thing over here. Okay, and the pinna up and back, no buildup, and the tympanic membrane is nice pearly white, whitish gray with no bulging. Okay. All right. Looking at the nose, it's symmetrical. There's no runny discharge or anything like that. I'm going to use my otoscope again to look up the nose. If you wouldn't mind standing up for me, I think that would be a little bit easier for me to visualize. And if you could tilt your head just a little bit for me. Thank you. Okay, clear, no masses. Both nares are clear. They look good. Okay. Go ahead and have a seat. I'm going to check your frontal and maxillary sinuses by kind of tapping on your forehead. If I were getting any dullness, that might be a sign that there's some fluid filling those sinuses, but I'm not getting any dullness when I do that. So the other thing you can do is illuminate with a pen light and see if you get a translucent light. Actually go underneath the brow and shine upwards, and you should have translucent light here, here. You can also do it down through the mastoid and look in the inside of the mouth for that. I don't have a pen light that's small enough to do that, but it's something that I saw. Okay, so next thing we're going to do is take a look at your mouth. Just perioral, I don't see anything. There are no sores on his lips or outside of his mouth. I'm going to go ahead and have you open your mouth for me. It's open real big. All right, I'm visualizing the teeth and gums. The teeth look normal. Gingiva look okay. No bleeding or anything like that. I don't see any masses in the oral pharynx. Go ahead and stick your tongue straight out for me. Move it left and now right. Okay. That lets us know that cranial nerves 9 and 10 are intact. The last thing I'm going to do is look far back with my tongue depressor. If you wouldn't mind sticking your tongue out for me one more time. Open real big. Okay, tonsils are intact, not inflamed, they look normal. Thank you. Okay, so the next thing that we're going to do is have a look at your chest. If you wouldn't mind taking your shirt off for me. And if you wouldn't mind standing up too, I'm going to turn the chair sideways because what I'm going to first do is assess your back. Go ahead and have a seat there. Facing this way if you don't mind. There you go. Okay, so looking for symmetry down the back. Curvature is normal. I don't see any scoliosis or kyphosis. I'm going to palpate the spinal processes. Sorry if this tickles. All right. Nothing abnormal felt there. Okay, if you wouldn't mind, go ahead and stand up. We'll have you turn back. I'll straighten up your chair here. Okay, let's see again. Actually, you know what? I apologize. Let me move this and have you stand up, sit on my makeshift examining table right here. Now look at your thorax. The first thing I'm looking for is just symmetrical expansion of his lungs while he breathes. Normal anterior, posterior dimension. I'm also going to put my hands on there and feel for expansion. If you don't mind, go ahead and breathe. Okay. Posteriorly, I'm assessing for phlebitis, tactile phlebitis. I don't feel any. And now, if you don't mind, I'm going to listen to your lungs, both posteriorly and anteriorly. Using the diaphragm of the stethoscope. Go ahead and breathe for me. Breathe deep. Another deep breath. Again. The fields of the lung posteriorly are all clear. We're going to assess in the front now. Breathe deep for me. All lung sounds are clear. There's no wheezing, rails, crackles. I think your lungs are within normal limits. Okay, so moving on, we're going to assess his cardiac status. What this involves is palpating the precordium and noting where the point of maximal impact will be, which is normally at the 5th interclavicular space on the left side, just left, or excuse me, 5th intercostal space, just left of the midclavicular line. We're going to listen to his heart sounds in 5 different places with both the diaphragm and the bell of the stethoscope. We start out with the aortic valve, pulmonic, second pulmonic, tricuspid, and mitral. And then, once again, we'll do that with the bell. You can breathe normally. Okay. All of his heart tones are normal. I hear an S1 and S2. No clicks, no murmurs, no lifts, heaves, or thrills. So I'm going to say that your heart sounds are normal. So now we're going to move on to the next part of our assessment. Just move a few things out of the way. While you're sitting up, I would be assessing for jugular vein distension, and I can see where his jugular veins would run. I don't see any distension there. Another technique that can be used is to shine a light kind of across the surface of the skin, looking for sort of the shadowing of the jugular vein on both sides. And I don't see any distension on either side. So I'm going to clear off my examining table here so we can have you lay down. And we're going to move on to the abdominal assessment. Here we go. Go ahead and lay down and get a pillow for you there. If you want to, you can put your legs up on the end if that's more comfortable, whatever works for you. So with the abdominal assessment, it's important to note that you first inspect, then auscultate, then percuss and palpate. The reason that we auscultate before we touch is we don't want to disturb any of the internal structure and create bowel sounds where we might not otherwise have them. So I don't see any obvious lumps, masses, or pulsations when I look at his abdomen. The next thing I'm going to do is auscultate all 4 quadrants. Positive bowel sounds in the right upper, no bruits. Positive bowel sounds in the left upper with no bruits. Positive bowel sounds in the right lower quadrant. And positive bowel sounds in the left lower quadrant. Okay. Next thing I'm going to do is percuss. I'm looking for tympany or dullness in places that there shouldn't be. And there isn't anything remarkable with that. The next thing I'm going to do is palpate lightly and assess for any masses. Any pain or discomfort when I'm touching you here? No? All right. Okay, and that concludes the abdominal assessment. Let me go ahead and have you sit back up. We'll get you on our higher examining table here. And I'm going to assess his lower extremities. First thing I'm doing is looking at his knees for any edema. Can you go ahead and lift your legs straight out for me? You can do them one at a time. Okay. Do you have any pain or discomfort when you extend your knee?
No.
No? Let's do this one. So normal range of motion in the knees, legs both look symmetrical. I don't see any surface abnormalities. Go ahead and take your socks off and look a little closer at your feet. There you go. And I don't see any edema. I'm going to palpate for pulses on both sides. First the dorsalis pedis on the right, and then the posterior tibial on the right. Both of those are there. I would say they're +2. Now on the left. And the posterior tibial. Again, +2. I don't see any edema. There's definitely no pitting edema there. And cap refill is about 1 second, so no perfusion issues there. So we've got that handled. Let's move on to the next section of our exam. This is going to be the motor exam. So if you wouldn't mind, let me have you just kind of let your arms dangle for a moment, and I'm going to assess your sensation. It's a dull and sharp stimuli. Go ahead and close your eyes for me. And tell me if this is dull or sharp.
Sharp.
And now?
Dull.
Okay. How about here?
Sharp.
And now?
Dull.
Here?
Sharp.
Now?
Dull.
Okay. Did you feel that? There's a cat looking at you.
Sharp.
Okay.
Dull.
All right.
Sharp. Sharp.
Okay.
Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, so sensation is intact. Reflexes, we'll start with your upper extremities, and we're going to do your biceps first, okay? So one way to find the biceps tendon is have you kind of pull your arm up while I put resistance on it. Go ahead and lift your arm. There you go. Okay, you can feel the tendon right there, so we'll place our thumb on it. And relax your arm. Look the other way for me. Okay. Okay, we get a contraction in the biceps. Okay, good. Brachioradialis on both sides. Okay, we get a little pronation and contraction in the forearm on the left. Same thing on the right. And now we're going to do triceps reflex. Just go ahead and relax. There we go. And over here. I'll try that with my thumb. Go ahead and relax. Let's see if we can find right on the tendon. There we go. Okay. Upper extremity reflexes are intact. Next thing we're going to do is try the patellar reflex. Go ahead and relax for me. Find that patellar tendon. There's that one on the left. And over here on the right. Make sure we got that. There we go. Okay. Patellar reflex is intact. The next one that we're going to do is the Achilles. So we're going to slightly dorsiflex the foot and tap the Achilles tendon. Yep, there we go. You get the contraction in the foot on the left and on the right. Perfect. Next one is the plantar or plantar reflex, where we're assessing for the Babinski response. We're looking for negative Babinski, where the toes curl forward. So let's try that real quick. Okay, good. I know it tickles a little, huh? There we go. Okay. So negative Babinski, which is what we're expecting. So we're going to move on to our last portion of the assessment here. I'd like you to Alternate slapping your hands on your thighs back and forth for a few seconds. Okay, great, that's fine. Now the next thing, tap your toes alternatingly on the floor. Okay, so our repetitive motion, rapid alternating motion is intact. Next thing I'd like you to do is look at me and touch my finger with your pointer finger as I move it around. Use the left one first. Okay. Now the right.
Sorry, that was my breaking.
It's okay. Okay, so proprioception and rapid repeating movement is intact. Next thing I'd like you to do is touch all your fingers to your thumb as quickly as you can do it with your right hand. Okay, and now try the left. Rapid repeating movement is intact. Okay, now the next thing I'd like you to do is kind of look up, extend both arms, and close your eyes and touch your nose. Okay, first with the left, and then with the right. Excellent. Okay. Now, if you wouldn't mind, run your left heel up and down your right shin. Straight up and straight back down. And the same thing on the other side. Very good. Okay. So our point-to-point proprioception is intact. Now we're going to check your gait. Go ahead and stand up for me. And if I had seen the patient walk into the office, I would be assessing his general gait. Go ahead and take your hands out of your pockets. I'd like you to walk over there, turn around and come back to me. And straight back. Perfect. Okay, looks good. Now we're going to do it by putting heel to toe. And the same thing, just walk across the room and come back to me. Heel to toe, heel to toe. There you go. All right. All right, balance is intact. Last thing, I'd like you to have a seat on the examining table, and I'm going to check your pronator. For this one, I'd like you to close your eyes. Let me see your hands. And extend them out. Pretend you're holding a pizza box right there while I count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There is no pronator drift. And this concludes the assessment of the adult patient. I would now wash my hands and move on to the next part of our visit.